I am now absolutely delighted to introduce the Honorable Mehmet Oz, the Administrator of the Centers for Medicare and Medicaid Services, to give our keynote address on making America heart healthy, a vision for bold preventive action. Dr. Oz's biographical sketch is in our program book. As CMS administrator, he leads the largest payer for healthcare services in the United States. The agency's decisions affect more than 4 in 10 Americans' access to health care.
Bernadette Melnick. Can't say no to her. And she was kind to invite me to kick off this year's National Forum Conference, focusing on heart health and disease prevention, two things that I am passionate about. We've been talking a lot about at CMS, but they're also important to my medical career, as many of you know. As a heart surgeon, I spent a lot of time trying to deal with metabolic syndrome and all the different processes that culminate in atherosclerosis, which I always felt, interestingly, although we could treat it with coronary bypass surgery and stents, those don't really replace the God-given gift of an open artery. Only changing the corrosive fluid inside of your arteries could do that. And so I would warn patients that I'm going to give you a man-made imitation of what you're born with, but unless you take care of it, it won't remain in the pristine shape that I'll try to restore it to. And because of that, I'm particularly attuned to the issues you'll be talking about over the course of this conference, but it's also become a major focus of CMS. And just to get everyone on the same page, CMS is a Center for Medicare and Medicaid Services. So we provide in social health insurance to our youngest Americans, because roughly 53% of all kids are covered by Medicaid or CHIP. Medicaid, again, insurance for folks who are under the poverty level generally. The CHIP program is for kids whose parents don't have much resources. Elderly folks are covered by Medicaid and Medicare oftentimes if they poor older people, but in average, the 65-year-old and above get Medicare, which is a beautiful social safety net program created 60 years ago this year. And then, of course, there are the Affordable Care Act exchanges that you guys hear about periodically, the Obamacare exchanges. So it allows us to cover a lot of folks. There are so people on commercial health insurance, and no matter where you are in America in terms of your health care coverage, you do tend to be wandering down the road to unhealthiness because of the chronic illnesses that we've allowed to prosper in this country. And we'll be talking about the most, popular topic these days, MAHA, Make America Healthy Again, in part because we've made it hard to be healthy in this country, and we want to address that. But I want to take a step back and start off with talking about the role of providers and doctors. We have a responsibility to tell patients what they need to know, even if it's not convenient, right? We're taught to do that. And that same culture plays a role when you're preventing chronic illness and protecting folks against heart health. If we don't tell them that our solutions, the mechanical ones that I spoke of earlier, are going to save their lives forever, we're not doing our job. We've got to warn them that hypertension, strokes, and everything in between are worsened by lifestyle decisions that they're making. Their medications, their devices, but nothing's as good as taking care of yourself, making sure you get daily exercise, eating food that's real, that comes out of the ground, looking the way it looks when you eat it. There's nothing like sleeping well and making peace with the world around you, dealing with the anxiety and depression that otherwise can become quite common. And if you don't deal with those issues, yes, you'll end up with quote unquote essential hypertension, which was always an interesting term to me because there's nothing essential about it. And there's subsequent illnesses that are attributable to it, ranging from strokes and heart attacks to kidney failure and the like. So the uncomfortable truth remains that the same disease that was the number one cause of death in the U.S. when I trained in medical school, cardiovascular disease, remains to be the number one cause of death. But that also gives me hope because there are things we can do to make a difference. That sacred relationship between doctors and patients that we've always had has been stifled. And so we can't actually communicate this important information, I don't feel, as effectively today as we could historically. And I think we need to change that. In fact, what I've started to say is that I'm concerned that a lot of doctors have lost their mojo. We've lost our belief that we are the ballast of society that helps the ship that's traveling into troubled waters weather the storm. So we've got to speak up. And I think patients have also been stifled by a medical system that's rife with fraud, waste, and abuse. So in order to make the system work better, to clean it up, to get it to be more efficient, docs need to get their mojo back. We can't be bogged down by endless paperwork and bureaucracy that keeps us from doing the things that we know we want to do in our lives. And if we get that straight, all of a sudden the bureaucracy starts to melt away and we begin to help patients in their time of need. So let's discuss what this really means. So to me, it starts off with things like patients over paperwork. Right? Are we going to be focused on the computer next to us typing away? Or are we going to actually look at the patient in the eyes, recognize that we've got a covenant, a precious relationship together with them, and nothing's going to get in our way? And if we can begin to move in that direction, then I think we'll have a much healthier healthcare system. Because most of my colleagues in medicine, you guys can attest to this, they don't leave medicine because of the work. They leave medicine because of the busy work. The stuff you're doing that doesn't give you that continuous daily feeling you're making a difference in other people's lives. And amongst those things that we're stuck on are things like coding. I want to mediocritize coding, literally make it irrelevant if you code well or not. Frankly, all that coding predicts maybe 15% of the variation that we see in healthcare expenses the next year. So we can do much better than that. And I'm intent to do just that. Another good example is prior authorization. I don't think it serves the purpose it was designed for. We need some prior authorization, but not thousands and thousands of procedures, and not the way we do it now, where the long arm of insurance protrudes into your exam office, that precious location, sacred location where you're talking to people about something really important to them. And all of a sudden, the patient's being told they can't get that test that tells them if they have cancer. And that's the kind of interaction that's not healthy for anybody in the system. Doctors, patients, the insurance companies have agreed it's not ideal. So we went out to the insurance companies and said, listen, we want to change the prior auth system. We're either going to get Congress to do it. And by the way, I'm in Washington, D.C. right now. I'm looking over this computer at the Capitol building. So I'm very close to where that law could have been passed. So we have plausible ways of doing this within legislative solutions. We also have regulations that CMS can make, rulemaking that can make life very difficult. Or I can come to the insurance industry, which we did with Secretary Kennedy. And President Trump was fully supportive of this, which one of the reasons I love working here is he gives us a lot of autonomy, a lot of freedom to go out and make a difference. Many of us came from the private sector for that reason, for a short stint to make a difference. And so if we're going to play a role in this process, then we need to actually get industry on board. So we said, listen, if you guys are the insurance coverage for 80% of the country plus, which they were, what can you do better? Could you make a gold card? So if a doctor's already doing a great job with their practice and they're not seeing a lot of patients that are being referred erroneously, give them a gold card, freedom to do what they want to do, don't get involved. There are systems that are already doing that, like Highmark, Allegheny in Western Pennsylvania. Or you do what Kaiser's doing, there's no prior authorization. They just tell doctors in timely fashion that they made a mistake, please don't do it again, and here's 5 other ideas you might want to think about doing. And doctors actually want to get better, and we don't repeat the same error over and over again. We didn't get through medical school making lots of mistakes. So that's sort of a high-level example of how we can use the long arm of government in a more effective way with a nimble solution that's fast, efficient, and adjustable. So as prior auth shifts and AI gets better, for example, maybe you don't need any prior authorization at all. And the ability to mediocritize coding, therefore, becomes something that is intricately tied into this new technology that a lot of people are scared about, but can be used for good. For example, many of your practices could be made more efficient if you had access to AI, knew how to use them, and it was affordable. You could have MD extenders. Maybe there's some of the things you do in your practice, or any clinician, frankly, could take advantage of that could be absorbed by an AI avatar, and then they hand the patient to you once they've been through this entire process, and you've already gotten all the information that's required to identify some of the reasons they're not doing the things you've been asking them to do. These avatars are remarkably sophisticated. And if you have not played with them, I encourage you to try it out, because they are actually able to tease out subtle reasons why patients aren't doing well that oftentimes in our busy clinical practice we might miss. We could also have AI play a role after they've you've seen the patient and they've gone home. Are they taking advantage of the recommendations you gave? What about their blockages you didn't know about, like they can't afford the medications? I mean, some of the things we've been doing with most favored nation drug pricing is going to help, because 1 in 3 patients goes to the drugstore and can't afford their meds. But you still need ways of helping patients do the things you're asking them to do. If they're depressed, or they're having a bad day and they decide to ignore your advice on their diabetes, you need to hear about that. Just playing a role, connecting you to the system and making sure they are in touch with you or your office, or at least the system you've designed to help them, would all be beneficial. And all of these, I think, are going to play a role in my organization, because things like Medicare open enrollment, which we're in the middle of now, are much more targeted and effective if we can enhance them by knowledge, with knowledge of what's going on in the patient's life. And AI can help us with that without intruding into the process, again, that special relationship that we have with patients. So let me now conclude with Maha. I promised you I'd talk about it. To me, the Make America Healthy Again movement is all about curiosity. Are you truly interested in examining what's happening in the world around us and maybe fixing it, at least addressing some of the shortcomings? And especially in rural America, we got lots of questions. Rural America doesn't get much of the money from the healthcare system. 20% increased incidence of all chronic diseases, including the ones you're focused on. A 3-year shorter life expectancy than urban America for that very reason. So if you're curious, and remember, 80% of questions are statements in the skies. So just because you're asking questions doesn't mean you want to know the answers. If you really want to know the answers, you're going to do something about it, you're courageous enough to take action, and hopefully compassionate as you do it, you'll get people to think differently about the role they play in making it easy for them and their families to do the right thing. If we can make that difference, and we can begin to get people to, for example, exercise 20 minutes a day, which just by itself we believe could take $100 billion off the healthcare system. Think about that. 20 minutes a day, that run you should have taken this morning, or maybe you did, yoga in your hotel room before you came down, that could generate 100 billions of savings to the U.S. healthcare system just by getting you to rev the engine a little bit. But its very core, Maha's about cooperation as well. We've got to get people working together, folks like you, thought leaders, individuals that are part of that balance of spoke of earlier in your communities, have got to speak up and be heard and be counted. Because I don't think my tenure here is about making cuts, although we are going to improve the efficiency of the system of healthcare in America. It's really about getting aligned on what matters most. And with that, I'll leave you to the rest of the conference. Blessings to all of you for what you're doing. Take care.
Thank you, Dr. Oz. You packed a lot into a brief address. Perhaps most important was that you have hope, because there are things that we can do to make a difference. Yes, there are. I was delighted when you said that getting people to exercise just 20 minutes a day could save $100 billion in healthcare costs. The National Forum's Move with the Mayor initiative brings changes that make a difference to over 200 communities across America, including enabling people to move. Move with the Mayor also strengthens many of the upstream conditions you outlined that are cornerstones of chronic disease prevention, such as exercise, healthy eating, sleeping well, and I loved how you said this, making peace with the world around you. We're helping mayors strengthen those vital conditions for health and well-being, and we're collaborating with National Forum members to extend and amplify that impact. I'm glad you highlighted that rural America has a 3-year shorter life expectancy than urban America. We will talk later in this meeting about how we can close that gap. You pointed out that AI could be used for good. We'll also hear more about innovation later in this meeting. Dr. Oz, the National Forum is grateful to you for being our keynote speaker today. We give you a dose of Dr. Melnick's vitamin G, that's gratitude, and we look forward to continuing our dialogue with you.